Okay, so Nathan and I have our capstone, and the capstone question that we have is the most effective balance interventions to improve function with those who have Parkinson's disease, Huntington's disease, and amyotrophic lateral sclerosis.
Okay, so the three neurodegenerative diseases, like Jeff said, we discussed Parkinson's disease, Huntington's disease, and ALS. So these neurodegenerative diseases are complex, progressive disorders characterized by various deficits to both motor and non-motor systems. The patients are likely to suffer from cognitive disorders all the way up to balance deficits as well. And then there are many CPGs and other articles that patients or other clinicians can use to help them guide them through their interventions and treatment. So starting off with Parkinson's disease, this disease affects both the motor and non-motor systems. Most likely you'll see balance deficits and you'll see cognition deficits as well. The disease targets the basal ganglia, specifically the dopaminergic neurons in the basal ganglia, and proteins called alpha-synuclein creates clumps, which causes Lewy bodies to develop, which is a hallmark sign of Parkinson's disease. Chronic inflammation can also happen, occur in the brain, which is caused by excessive microglia cells as well. Epidemiology, so I have the numbers written down. The epidemiology, about 8.5 million individuals are affected, and this results in about 5.8 million disability adjusted life years. So 8.5 million years taken off of individuals' lives, and it affects it mostly around 50 to 60 years of age. And the cardinal signs and symptoms are bradykinesia, tremors, rigidity, and postural instability. So there's 4 cardinal symptoms. The stages that are included are the Hoehn and Yahr stages. They are classified as 1 through 5. In this study, we reviewed mostly stages 1 through 3. The studies did not include stages 4 and 5 just due to the too many deficits of the signs and symptoms that they present with.
All right, so next we're going to talk about Huntington's disease, and a little bit of background on Huntington's disease is that it is a autosomal dominant inherited disorder that causes gradual degradation of the neurons inside the brain. More specifically, it causes an increase in the CAG gene, or the sequences on the Huntington gene. An individual who has over 39 repeats of the CAG gene is categorized as guaranteed to have Huntington's disease, because the normal amount is below 26. Some people range in between those areas, which might mean that you get it a lot later in life, but that magic number is 39, which kind of guarantees that disease. This increase in CAGs, the CAG gene results in neurodegeneration of cells in the putamen and the caudate, which are part of the striatum of the brain. According to meta-analysis, the epidemiology is about 2.7 in 100,000 individuals will have this degradation, and it will result in physical, cognitive, and emotional disorders as well. Some signs and symptoms. The most common and widely regarded symptom is chorea, which is a sporadic-like movement of the upper and lower extremities. This also includes deficiencies such as walking, dystonia, and akinesia. One or more of a combination of these attributes can result in a deficit of postural balance and stability. All right, so moving on to amyotrophic lateral sclerosis, or more commonly known as ALS. It is a disease that affects the motor neurons of the brain and the spinal cord. This eventually leads to neuronal or cell death and deterioration of the cells in the area. A hallmark sign is the deterioration of the upper and lower motor neurons located in the motor cortex of the brain and the spinal cord. Disruption of these neurons creates like a miscommunication between the brain and the muscles, which eventually leads to muscle atrophy. Another key component of ALS is exotoxicity, which is a process where there's an increase in glutamate in the brain, which further leads to that neuronal damage and motor cell death. It is estimated that 6 per 100,000 individuals will have ALS, and usually they have a prognosis of about 3 to 4 years following the onset or the diagnosis of the disease, so it is very fast acting. There's no definitive etiology of ALS. However, some evidence points to environmental factors as far as diagnosis goes. Patients who are diagnosed with ALS will eventually have difficulty speaking, breathing, and talking, speaking and moving and breathing. And then ALS patients require a vast amount of support from the interdisciplinary team. So they'll have a huge range of caregivers, from physical therapists, occupational therapists, nurses, physicians, respiratory therapists, to make sure that their quality of life is sufficient.
Okay, moving on to our methods. So for our study, we used the PRISMA methodology, which is just following a sequence of checklists, so intro checklist, and methods checklist, and so on and so on. So we started our search off finding 3 databases, PubMed, CINAHL, and Pedro, and we used our search terms, which included Parkinson's disease, Huntington's disease, ALS, postural imbalance, independence, physical therapy, function, and quality of life. And we inserted those terms into each database to draw our results. For our inclusion criteria, all articles must have included physical therapy with a focus on balance and balance interventions. And the studies that we found included systematic reviews, CPGs or clinical practice guidelines, meta-analysis, randomized controlled trials, case studies, and other clinical trials. We excluded articles that did not include physical therapy, did not include balanced outcomes, or were not within the last 10 years of doing within our research. In terms of organizing and sorting our data, we formulated a literature grid, and we separated each article by their author, title, journal, their publishing year, the purpose of each article, independent and dependent variables, subject and characteristics, outcomes, clinical relevance, and strengths and weaknesses. And then from there, we identified similarities and differences between each article. And from there, we could identify gaps of knowledge between each disease.
So moving on to results. We started off with 3,037 articles at the beginning of our search, which was eventually narrowed down after a screening was done to 181 articles. From there, we started to implement search terms such as balance, outcome measures, publications within the last 10 years. And once those search terms were modified, we were left with 17 articles for review. More specifically, we had 9 studies with Parkinson's, 5 with Huntington's, and 3 final articles with ALS. We had a variety of different countries that we gathered articles from, 7 to be exact. And as far as the studies go, it included articles such as systematic reviews, meta-analysis, randomized controlled trials, case series, clinical decision trees, clinical trials, and clinical practice guidelines. So our synthesis of results, 7 out of our 9 Parkinson's disease studies demonstrated improvement in balance by using outcome measures such as the Berg, Tinetti, Mini-Best. Two of those 9 studies of Parkinson's studies, or 2 of the 9 Parkinson's studies mentioned the TUG test, which has balance components incorporated with it. All Parkinson's disease studies show some type of movement with balance, but only a few were considered significant. 5 out of the 9 Parkinson's disease studies included some form of non-conventional therapy. That therapy could be virtual reality, exergaming, Dance Revolution, aquatic therapy. And 2 of the 3 articles that involved virtual reality had significant balance improvement. 4 out of the 5 Huntington's disease studies showed some significance of balance or dynamic mobility, and improvement when using the Berg balance scale, or actually as well as the TUG or Tonetti. 2 of the 5 Huntington's disease showed visible improvements in middle and late stage Huntington's disease, and one of the 5 articles showed that Dance Revolution and the 4-square step test did not impact functional mobility or balance. However, the same studies showed that multi-directional stepping and video game-based activities showed improvement in balance. So ALS was a little bit more tricky. It did not really include balance-specific interventions. The studies that we found were more focused on quality of life and how patients coped with the disease and their caregivers. The articles that did report about physical therapy, the articles that reported that early physical therapy interventions to address impairments are significantly important to improving function and quality of life.
Okay, so from our findings, balance exercises has shown overall to improve function and quality of life in Parkinson's, Huntington's, and ALS. However, various balance interventions various types of interventions were used, and different outcome measures were used as well during those studies, so it was hard to determine a single best balance exercise for each of the 3. Interventions in terms of Parkinson's specific interventions that we looked at were Tai Chi, dancing, aquatic therapy, gait training, resistance training, and then there was feedback, or technology for feedback, aka virtual reality training or other technology training as well. So what we found for Parkinson's is that virtual reality or biofeedback training and dynamic balance training were highly recommended. And this is according to the CPG regarding Parkinson's disease from the APTA. They recommend that VR and biofeedback and dynamic balance training were the best due to the number of high quality evidence that was involved. An example of Fang et al., one of our articles, found that virtual reality training significantly improved balance over a 12-week period. The scores of the Berg balance scale improved by 6 points. TUG scores were reduced by 3.29 seconds, and functional gait assessment scores improved by 6.5. And that was compared to the traditional therapy, which there was significant differences between the 2. Another article was from Ratter, and they analyzed various dynamic balance interventions, and they found that strategy training, dance, martial arts, gait training significantly improved Berg balance scores and their their time to bingo scores as well.
For Huntington's, there was little evidence showing that multi-directional stepping and video game-based activities showed improvements in balance. Clues et al. Did an article where the participants who played Dance Revolution showed significant improvements in the proportion of correct steps and maximum combination of steps per song, specifically in the first 2 sessions and the final 2 sessions. As far as ALS evidence goes, we didn't really find much literature regarding specific balance interventions to improve function. Some articles state that physical exercise may be detrimental and not improve muscular strength and compromise muscles, while others say that traditional physical therapy is better than no physical therapy. ALS articles mainly focus on quality of life and respiratory therapy and interventions regarding breathing, due to the major focus of just improving quality of life, since they're going to be declining steadily anyway. This explains why balance is not widely researched, and we had Majmudar et al., who recommends that those with ALS should begin skilled therapy as soon as possible, and that's more for the purpose to maintain quality of life and to be appropriate with caregivers, not so much from balance and muscular strength.
So, pretty much overall, there was a scarcity of research in ALS, just due to the fact of the focus was respiratory interventions and focusing more on quality of life. We'll discuss on why we think that is later on. So overall, there was no best balanced interventions to improve function in those with Parkinson's, HD, and ALS, just because of the vast amount of interventions that were used and the vast amount of outcome measures that were used to measure those results. So there was just too much, or I should say, not enough consistency in between the results.
So moving on to limitations. With our question, we had limited research regarding specific balance interventions to improve function in those affected by specifically ALS and Huntington's disease. The current literature demonstrates that general exercise and physical activity can have a positive effect on balance, secondary to functional strength. Due to the lack of peer-reviewed evidence, with balance interventions with ALS, we couldn't come to a conclusive finding. Parkinson's and Huntington's had a variety of outcome measures, making it difficult to come to like a kind of a consensus on what outcome measures would be best for patients with these populations. And it made it challenging to decide what would be best for the function in the patient at each stage of the disease. Quick note about the term function. We used that in our original PICO question, and it was broad and difficult to gather research based on that question appropriately. So we have suggestions in future research to change the word function in future scoping reviews could provide more clarity and narrower results. Treatment protocols were similar in Parkinson's and Huntington's disease with regards to comparing intervention groups to traditional intervention groups. ALS contained mainly single case studies, and the difference between ALS treatment protocols compared to Parkinson's disease and Huntington's disease demonstrates difficulty comparing the three neurodegenerative diseases and providing kind of unclear results. So the scoping review overall was to assess the literature regarding these three neurodegenerative diseases, Parkinson's disease, Huntington's disease, and amyotrophic lateral sclerosis, and what would be best, what outcome measures would work best on the patient population given their diagnosis and their stage of disease. Overall, dance and virtual reality gaming provided the most conclusive evidence showing that there was improvement in function with Parkinson's disease and Huntington's disease. However, it should be noted that the combined findings are inconclusive due to the different outcome measures used. Again, ALS had limited research regarding balance interventions and with improving function. Their limited time frame and diagnosis made it more important to work on quality of life and respiratory therapy over balance and muscle control. Largest gaps that were identified in our literature were regarding the amount of literature that we found with ALS and Huntington's disease, and the difficulty finding the most evidence-based outcome measures, particularly in balance with patients with Parkinson's disease, Huntington's disease, and ALS. So for future research, we recommend that larger scoping reviews are done focusing on treatment of ALS and Huntington's disease, discussing more on ALS treatment and outcome measures. Future studies should focus on the effects of rehabilitation of ALS and Huntington's disease. Alternative forms of exercise should be looked into, as as well as like dance, virtual reality, extra gaming, and aquatic therapy. Lastly, we should focus on larger sample sizes to increase accuracy and reduce random variability. And specificity could also be expanded to include review questions on Parkinson's, Huntington's, and ALS instead of just one broad encapsulating question. So we want to be able to, instead of one broad encapsulating question, we make more definitive questions for each different branch. All right. And these are our references. Thank you.